So the first one I'm going to talk about is going to be the TCA cross. Years ago when I started doing acne scar treatments, laser would be my first treatment options, but now I'll tell you the TCA cross is my number one procedure that I do. It's because I truly believe it gives more consistent, better results for deep acne scars. So I'm going to basically show you guys, this is what I use. It's called TCA 80%. So the way it works is that we dab a little bit of the TCA onto the acne scars. So we take the cotton tip applicator, we break it in half, and we dab into a little bit of TCA and darkly put it into the acne scar. In my experience of doing this for many years, I've used it in box scar as well as ice pick scars, and I see very good improvement basically in both scenarios. Once we dab the acid onto the acne scars, you basically let it sit. It's going to frost. It's going to scab for about a couple days to about a week, and then over time it stimulates collagen production in that area. Patients typically get about 10% improvement per session. However, there are many patients that actually sometimes get 15, 20, 25, 30% or even 40% improvement with just one session. People respond differently, and the results vary from one patient to another patient. Typically, younger individuals have better collagen production rates, so they respond a little better than older patients. Side effects of TCA. It's very safe overall. If you're darker skinned individuals, I would typically pre-treat with bleaching cream called hydroquinone in order to prevent what's called post-inflammatory hyperpigmentation. That means getting some brown spots in the areas. There's also another risk of getting some red spots in the areas, kind of as if when you get the acne, you leave some red spots behind. That could also happen. It's rare, it doesn't happen all the time, maybe about 5% of patients, mainly darker skinned individuals. It will always go away. You can also do V-beam laser in order to make the redness go away as well. Besides that, overall, it's a very safe procedure. I truly believe it's one of the best treatments out there. It's more affordable than a laser resurfacing, less downtime, there's no antibiotics required. You obviously have to stay out of the sun, but it's a very quick procedure that could give patients really good improvement. Years ago when I got started, the CO2 laser was my number one method of treating acne scars, and we'll demonstrate that today. And I still use it quite a bit. But I truly believe for deep acne scars, the CO2 laser does not really do a very good job. So what I usually do, I treat the deep acne scars with several sessions of the TCA cross technique. Once basically it fills in, then I'll go ahead and basically do a resurfacing on top in order to smooth it out. An example that I always give my patients is that if you have a pothole in the street, so you have two options. One, either filling the pothole first or doing asphalt on top. So the asphalt is like basically doing a laser resurfacing on top. Filling the pothole is like doing a CO2. The idea is to fill the pothole first in order to fill it in, and then you fill out the top. And that's what this technique of doing TCA first followed by CO2 basically correlates to. So this is TCA 80%. It's for TCA cross technique of acne scars. I love it. It's my number one go-to procedure in the office for acne scar treatment.